I'm Sophia, and I'm going to walk you through how to inject Gonal F RFF RediJect pen under the skin or subcutaneously. These instructions are broken up into 6 quick steps, which you can jump to at any time using the chapters below. Let's start by making sure you've got all your supplies ready to go. A Gonal F RFF RediJect pen at room temp. One of the single-use disposable needles supplied with the pen, plus alcohol pads, a gauze pad or cotton square, a sharps container, and a clean surface. Now, go ahead and wash your hands really well with soap and water. Then you're on to preparing the area where you'll give yourself the injection. There are a few places where you can inject your medication under the skin. In the abdomen, just below or to the side of your belly button, or in the leg, in the upper outer area of your thigh. No matter which area you pick, try to avoid injecting yourself in the same exact spot each time to lower your risk of a skin reaction. And never inject into any area that's tender, red, bruised, or hard. For today, I'll show you how to inject in the abdomen since it's the most common spot. First, use an alcohol wipe to clean the skin about 2 inches around the injection area. Then, give it a couple of seconds to dry while you get your medication ready. Next, you're going to want to take a good look at your pen. Make sure it's not expired and it's at room temp. This usually takes about 30 minutes from the time you remove it from the fridge. Next, remove the pen cap and confirm there aren't any cracks in the plastic window and the needle seal isn't broken. Also, check to make sure the liquid in the pen's reservoir is clear with no particles floating around. If you see anything, don't use it and call your healthcare provider right away for next steps. Finally, check the dose display to make sure it reads 0. If it doesn't, turn the knob counterclockwise until you see the 0. Now, you'll attach the needle. Start by wiping the tip of the pen with an alcohol swab. Peel off the seal from the outer needle cap and screw the needle onto the pen in a counterclockwise direction until it's secure. Then remove the outer needle cap and set that aside for later. Point the pen up and carefully remove the inner needle shield and toss that into the sharps container. If you're reusing a pen, there's no need to check for a droplet. So skip ahead to dial your dose in step 4. If you're using a pen for the first time, check for a droplet of medication at the tip of the needle. Seeing the droplet is really important. Otherwise, you may not inject the right amount of medication. If you do see one, skip ahead to dial your dose in step 4. If you don't see one, turn the knob until the dose window reads 25. With the needle pointing up, tap the reservoir to allow air bubbles to rise to the top. Then using your thumb, press the knob all the way in and hold until you see 1 or more tiny droplets at the tip of the needle. Go ahead and release the knob and make sure the dose display reads 0. Now you are ready to dial your prescribed dose. Turn the knob clockwise until your dose shows in the display window. If you turn past your dose, don't worry. This is easy to fix. You can just turn the knob backward and start again. Now you're ready to inject the medication. So let's do it. First, double check to make sure the display reads your correct dose. Hold the pen in one hand and with the other hand, pinch a fold of skin around the injection area. Insert the entire needle straight into the skin at a 45 to 90 degree angle. Press the dose knob down as far as it will go. Hold the dosing knob down and wait 5 seconds with the needle still in your skin to make sure you've received the full dose. Then, let go of the skin you're pinching. While still pressing the knob, remove the needle from your skin. Release the knob and press down firmly on the injection area with a gauze pad or cotton square. Nice job! Go ahead and put the pen down on a flat surface and check to make sure the display window shows 0. If it doesn't, it means you didn't complete your dose. If this happens, look at the number in the display. That number is the amount of medication you'll need to inject using a second pen. If you're unsure about this or have any questions, call your healthcare provider. Now, your final step is cleanup. Find the outer needle cap and lay it on its side. With one hand, hold the pen with the needle attached. Then slip the needle into the outer needle cap without using your other hand. Push the cap needle against a firm vertical surface, like a wall, until you hear a click. Then twist off the cap needle and toss it into the sharps container. After removing the needle, recap the pen. If the pen is empty after your injection, toss that in the sharps container too. If you still have medicine left in your pen, you can store it in the fridge or at room temperature for up to 28 days. And that's it. Thanks so much for watching today. Take care.